Children and the Persistent Concussive Syndrome. What children are at risk for the development of the persistent post-concussive syndrome following a sports-related concussion? That's a good question that clinicians and parents need to consider in determining when it is safe to allow a child to return to play and when further intervention is required. But there is very limited research, so a new research article published in the British Journal of Medicine from the Buffalo Concussion Management Clinic attempts to develop a decision rule tree to answer these important questions. The researchers have developed a brief, standardized physical examination to determine what players would develop the persistent post-concussive syndrome. But first, what is the persistent post-concussive syndrome? It is the persistence of post-concussive symptoms, physical, cognitive, emotional, and behavioral beyond the predicted normal course of recovery. Cognitive symptoms can include difficulties with attention, memory, and focus. The post-concussive syndrome often causes patients to sleep more than usual at first, and then many develop issues falling asleep. It's very common after a concussion to be more irritable, and with this syndrome, many can experience anxiety and depression. Physical symptoms also include headaches, dizziness, and sensitivity to light and sound. What the normal course of recovery should be is also an interesting and vexing question, since many studies have shown that recovery can take place for months or even years, while others claim recovery should take place in weeks. The Buffalo group recognized that children take longer to recover from a concussion than adults. And many practitioners wait a month or longer to determine how the child is recovering before making any judgments or decisions about further care. But the Buffalo group believes this delay may lead to a higher risk of persistent impairment and poor outcome, including persistent physical and cognitive symptoms, including difficulties with academic work and difficulties in social life. So they have developed a scoring system based upon their observation of concussed student athletes, their symptoms and recovery times. Something simple that could be easily used by school personnel, trainers, and medical professionals. I want to be clear. I'm not voicing an opinion on the merits of this simple test because I have observed in discussions and in my readings often a concussion is misdiagnosed by emergency department personnel, and children's complaints go ignored, or even children are reluctant to inform parents, school personnel, and medical personnel about the problems they are having. But I still want to pass this important information along to those interested in this subject. The researchers found the primary signs that indicate a child or adolescent with a concussion will have a delayed recovery include lightheadedness and dizziness upon standing from a lying down position, problems with balance and vision, difficulty in performing what is known as a tandem gait test when an individual is instructed to walk heel to toe. A child with these difficulties is more likely to develop the post-concussive syndrome, according to these researchers. So more observation and attention and intervention needs to happen. A concussion, even one concussion, can cause serious and permanent consequences. So it's important that this research continue for the proper screening of children who have sustained a sports-related concussion. Thanks for joining me this week, and I look forward to seeing you again next week on a new edition of the Brain Injury Insider from our new location in New York City. Till then, stay vigilant and stay safe.